We stand on the shoulders of those who laid the groundwork for us. They saw the need for an organization for black dentists. They overcame the atrocities of Jim Crow. And because of them, today, we are a legacy of leadership, a tradition of service. We are the National Dental Association, celebrating 100 years of greatness. In 1900, 12 Howard University dental alumni met in Washington, D.C., and founded what was then called the Washington Society of Colored Dentists. There was a need for a professional dental organization to address the needs of colored professionals. They planted the seeds for what later became the National Dental Association. In 1913, the Tri-State Dental Society was formed and included D.C., Virginia, and Maryland. By 1918, members from other states had joined, and the name changed to the Interstate Dental Association. Word spread across the nation, and new chapters formed. In 1932, the name officially changed to the National Dental Association. In the early years, the strength of the organization came from persevering men and their families, determined to create an organization they could call their own. The first secretary-treasurer was Dr. John Andrew Jackson of Charlottesville, Virginia. He and his family were the foundation upon which the organization was built. Every member of his family served in some capacity. The NDA owes a debt of gratitude to their passion and commitment. When the patriarch died in 1957, his sons, Dr. George Franklin Jackson and Ellard Punjab Jackson, followed in his footsteps. Punjab served as executive director for 25 years without pay. At the height of the Jim Crow era, the NDA continued to fight for the rights of Negro dentists. World War II veterans returned home and faced discrimination and bigotry. They were denied their basic rights. Negroes were not accepted in mainstream society and could not join the all-white American Dental Association. Civil rights laws attempted to correct the injustice. Dr. Eddie G. Smith wrote the first NDA Constitution and formed its first House of Delegates. NDA leaders argued passionately before Congress to include dental care in both Medicaid and Medicare programs. However, the heavily funded ADA struck down their efforts in Medicare. In 1965, the Medicaid bill was enacted, ensuring that poor children received much-needed dental care. However, even today, dental care for seniors is not covered under Medicare. The passage of Medicaid attracted new members to the NDA. In the 60s, the Black Power, women's rights, and student movements transformed America and the NDA. The NDA moved its home office from Charlottesville, Virginia, to Washington, D.C. An executive director was hired, and the annual convention adopted a more sophisticated format. The NDA umbrella of family organizations was unique. The National Dental Assistants Association, the National Dental Hygienists Association, auxiliary to the NDA, and the NDA Foundation are vital components. In 1972, the student NDA joined the family.
And the trustee board, we managed to make it through there. We had a majority vote, had a big majority vote, as a matter of fact. Once we went to the House of Delegates, however, it became a battle.
It was just what the organization needed. Students are the lifeblood of the NDA. In that same year, the NDA published The Charrette, which chronicled the plight of those neglected by the healthcare system. The book challenged the NDA to become the voice of moral authority. Throughout the 1980s and 90s, the NDA raised its profile. In 1989, Colgate-Palmolive and the NDA became partners. Colgate has provided funding for dental research and millions of dollars in scholarships. In 1993, the NDA Women's Health Symposium was formed to address the needs of women and to honor their achievements. The Corporate Roundtable was formed in 1996 to provide resources and strategies for win-win partnerships. Henry Schein Incorporated, a founding member, has been another dedicated partner, contributing to NDA growth and progress. After 84 years, in 1997, the first woman was elected president of the NDA. 2 years later, the first annual NDA Day on the Hill was held. It is a unique program of information exchange between the NDA and legislators.
And I want to thank this organization for helping us to make sure that there was a pediatric dentistry benefit in the Affordable Care Act.
1999 strengthened strategic alliances cultivated to expand the organization's realm of influence. These organizations are valued allies. It became vitally important for the NDA to publicize its positions and to influence public policy. In 2000, the first NDA component, the Freeman Dental Society, celebrated its centennial. The first ever Surgeon General's report on oral health in America was released. Dr. Clifton Dummett was commissioned by Dr. Roosevelt Brown, president of the NDA Foundation, to write the NDA history, published in 2000. In 2005, in the aftermath of Hurricane Katrina, the NDA led the movement to enlist the support of other organizations, and Congressman John Conyers, chairman of the Judiciary Committee, to bring to justice the New Orleans policeman who killed a frightened, unarmed man. The man was the brother of NDA past president, Dr. Romel Madison. Civil rights and social justice are hallmarks of the NDA. The Eddie G. Smith Leadership Institute hones the skills of NDA leaders, ensuring leadership succession and securing the future of the organization. Tragedy struck in 2007 when Diamante Driver, a young boy from Maryland, died from untreated tooth decay. Local NDA dentists galvanized and with state, community, and corporate support created a project in his memory and purchased a mobile dental unit. The death of Diamante was a call to action. In 2009, the NDA co-hosted the Roundtable on Oral Health Disparities with the Department of Health and Human Services Office of Minority Health. The session exposed health disparities and vulnerable communities to an audience of the nation's most prestigious organizations. Our alliance with the Hispanic Dental Association and the Society of American Indian Dentists culminated in the historic Multicultural Oral Health Summit of 2012. The groups pledged to work together to improve health in communities of color and all underserved communities. Community service is a cornerstone of the NDA. In 2012, the NDA and Philadelphia's New Era Dental Society accepted an invitation from media giant Tom Joyner.
Good health starts with oral health, and so it's a natural fit.
The impact of women leaders has changed the landscape, and they are leaving their mark. The NDA's $1 million Centennial Campaign establishes an endowed scholarship fund and increases support for local programs such as the NDA Health Now, a national grassroots mobile health project that expands and takes to scale the Diamante Driver Dental Project. For the past 100 years, the National Dental Association has been leading the way for dentists of color to provide quality oral health care for the underserved and underrepresented. The National Dental Association, a tradition of service, a legacy of leadership, making a difference in the lives of millions.